Welcome to Guide Mia. Today we're going to talk about taking your monitoring photos. If you're wearing clear aligners and your orthodontist or dentist asked you to send in progress photos regularly, this is the video for you. The idea is simple. Every so often, Cympha emails you a reminder, you tap a link, and your phone guides you through 5 photos of your teeth, front, left, right, upper, and lower, so your doctor can check your progress between visits without you coming in. The very first time takes about 3 minutes, including signing in. Every time after that, it's about a minute. In this video I'll walk you through the whole flow, show you how to line up each shot, and cover what to do when a photo looks off. Follow along with your phone, or just listen now and read the guide later. 4 things, and you almost certainly have them all. First, the reminder email from Cympha telling you it's time for your next set of photos. That email is your entry point. Second, the same email address your doctor invited you with. If you sign in with a different one, you won't see the plan they set up for you, so stick with the address the invitations come to. Third, a phone with a working front camera and a steady hand, or borrow a friend's hand. A helper genuinely makes the side shots easier. Any phone you already own is fine, no special device is needed. A bathroom mirror, or any room with soft overhead light, helps but isn't required. And best of all, there's nothing to install. The whole flow happens right in your phone's browser. Step 1 couldn't be shorter. Open the reminder email and tap the button that says Take Photos Now. Your browser opens, and it signs you in automatically. If it's been a while since you last used Cympha, you might be asked for your password. That's the same one you set up the very first time your doctor shared your plan with you. Type it in, and you're through. If you've forgotten it, the sign-in page can send you a reset by email, so nothing is ever lost. That's the whole of Step 1, one tap, maybe one password. Step 2, a quick check before the camera comes out. A small box at the top of the page shows your current treatment step, something like Step 3, continue. Cympha pre-fills this for you based on your schedule, so most of the time you don't touch it at all. The only reason to change it is if you move to a new tray earlier or later than planned. In that case, tap the box and pick the step you're actually on, so the guide matches your real teeth. And if you're honestly not sure which step you're on, just leave it. Your doctor will see the photos either way, and they can sort out the numbering. Tap continue, and let's take some pictures. Now the heart of it. The page shows 5 circles, labeled front, left, right, upper, and lower, with a save button at the bottom. Each circle is one photo. Tap front, and 3 things happen at once. The 3-dimensional model on screen rotates to show what the front of your teeth should look like at your current step, your phone's camera opens, and the plan jaws appear faintly behind what the camera sees, like a translucent guide floating over the picture. Here's the technique. Hold the phone close to your mouth, close enough that your mouth fills the frame. Open so your top and bottom teeth show. Then move the phone, or your head, until your real teeth line up with that faint guide. When it looks right, tap the round shutter button, then tap Use Photo. The front circle turns green with a tick. Not happy with the shot? Tap Retake. You get as many tries as you want, and only the photo you accept gets saved. For more, same rhythm. Tap left, the model rotates to show the left side view. Tilt your head to the right, or angle the phone to the left, so the camera can see the inside of your left cheek. If your lips hide the back teeth, use a cheek retractor if your doctor gave you one, or simply pull the corner of your mouth aside with a clean thumb. Snap, tap Use Photo, and left turns green. Tap right and repeat, mirrored. Then the bite surfaces. Tap lower, tilt your head back and open wide, so the camera looks up at the upper teeth's biting surface. Tap upper, tilt your head forward, so the camera looks down at the lower teeth's biting surface. Those 2 feel a little acrobatic the first time. The guide on screen shows you the angle it wants. When you're done, all 5 circles are green, and that's your full set. The last step is one tap. Once all 5 circles are green, the Save button at the bottom of the page turns blue and becomes active. Tap it. You'll see a progress bar for a few seconds while your photos upload, and then a done screen with a short thank you. That's it, you're finished, and there's nothing to confirm or send afterwards. The next reminder will arrive on whatever schedule your doctor set for your treatment, and next time you'll fly through this in about a minute. One honest note, the first round is often the roughest. Everyone fumbles the side shots once. It gets quicker and cleaner every single time. A few habits separate photos your doctor can use from photos they'll ask you to retake. First, fill the frame. Your mouth should be roughly the same size as the guide on screen. Don't shoot from across the room. Second, mind your tongue. Push it down to the floor of your mouth before each snap, so it isn't hiding the teeth your doctor needs to see. Third, for the side views, get your lips out of the way, a thumb or a cheek retractor, because the doctor needs the back teeth, not your lip. And fourth, light. Soft, even light is best. Natural daylight in a bathroom mirror works beautifully, and a direct overhead lamp is fine. What doesn't work is the phone's flash, it makes everything shiny and washed out. For small habits, and every round you send is one your doctor can actually read. So where do the photos go? When your doctor opens your case, your photos sit right next to the three-dimensional plan at each step, so what your teeth actually look like sits beside what they were supposed to look like at that point in treatment. That side-by-side is the whole magic of monitoring. Your doctor can spot early whether things are tracking, without waiting for your next chair visit. The reminders keep arriving on the cadence your doctor chose for your case. And if life happens and you skip around, travel, exams, a lost phone, you don't lose your spot. Just pick up wherever you are when the next reminder lands, or open the case yourself and send a set. Questions about how your records are handled belong to your doctor's practice, so ask them directly, they know your arrangements. And the fixes, so a hiccup never costs you a round. The email link says it expired? Reply and ask your doctor for a fresh one, or skip the email and sign in at app.cympha.com. Your case is under My Cases. The camera won't open in the browser? It's being blocked in Chrome or Safari. Tap the lock icon in the address bar, allow the camera, and refresh. No faint guide behind the camera view? Some older phones can't show the overlay, the flow still works. Take the 5 photos at the listed orientations against the plain 3-dimensional model instead. The upload spinner runs forever? The photos are bigger than a text message, try again once you're on solid Wi-Fi or signal. One photo came out blurry? Tap that green circle and retake just that one, never all 5. And for extras, like a chipped tooth or a popped attachment, don't force them through this flow, text or email your doctor the shot and explain what they're looking at. That's the whole routine. Tap the link, confirm your step, 5 photos lined up to the guide, and save. A minute a round once you've done it twice. And it's worth remembering why it matters. Every round you send means your doctor is genuinely watching your progress between visits, comparing what your teeth look like against what the plan says they should, and catching anything early, all without you taking a morning off for a chair visit. The 4 habits carry you: fill the frame, tongue down, lips out of the way, soft light. The first round is the clumsiest one you'll ever take. After that it's just part of the aligner rhythm, like swapping trays. Your doctor set this up because it keeps your treatment on track. A minute from you closes the loop. Everything from this video is written out, with pictures of each screen, at cympha.com. Open Docs and find how to take your monitoring photos. If your doctor uses Cympha, you might also like the guide on opening your treatment plan for the first time. We're walking through every Cympha workflow, one lecture at a time. Subscribe if you'd like the rest. Thanks for watching, and happy snapping!